Calgary-West.
Thank you, Mr. Speaker. The first step in dealing with addiction is admitting you have a problem. Unfortunately, addicts remain in denial for years, but in doing so, they damage everyone around them. Premier, Minister of Health, Associate Minister, Justice Minister, you all have a problem because Alberta has an opioid crisis. Agreed. And you are in denial. To the Premier, will your government take that first courageous step today and admit Alberta has a public health emergency?
Minister of Health.
Thank you very much, Mr. Speaker, and to the member for the question. We have taken many actions to make sure that we're addressing the extreme situation that is happening in Alberta with regard to the opioid epidemic. That's one of the reasons why we're making naloxone kits available throughout the province to make sure that anyone who wants one can get one. That's one of the reasons why we're moving forward aggressively on supervised consumption services to make sure that real harm reduction strategies can save lives. I hope the members opposite will determine which side of the debate they want to land on that one, because this is a life-saving strategy, Mr. Speaker. And I know that the member, my colleague, the Associate Minister, will have more to say in supplemental answers, Mr. Speaker.
Mr. Speaker, thank you. Given that the federal government has set aside $65 million in funding for provinces to respond to their fentanyl crisis, and given that Alberta will not even admit it has a crisis despite the deaths of 717 citizens in 3 years, and given that Alberta could use that money to fund crucially needed programs to reduce opioid abuse, to the Health Minister again, when are you going to request Alberta's share of that $65 million?
Hear, hear. Associate Minister of Health.
Thank you, Mr. Speaker, and to the member for the question. Our government has been working very closely with our federal counterparts to ensure that we have a seat at the table around all discussions around funding for mental health and addiction. Make no mistake, Alberta will get a fair deal and a fair part of that, and we'll have more to say about that in the coming days.
Second supplemental.
Mr. Speaker, given that the BC was quick to declare a public health emergency after overdoses spiked in Vancouver, and given that it has received $10 million from the federal government to combat the opioid abuse, and given that Alberta's stubbornness has meant that we are refusing to accept millions of dollars to fight our own crisis, to the Minister, please tell Albertans what it will take for you to declare a public health emergency.
Honourable Minister.
Thank you, Mr. Speaker. Our government is working very closely with public health officials. We're meeting with experts in drug addiction as well as people with lived experience who actually, Mr. Speaker, are some of the foremost experts in what it will take to help address this problem. And, Mr. Speaker, we haven't declared an emergency because we have the tools that BC needed to call an emergency for. We are continuing to move forward on a variety of fronts. Is there more work to be done? Absolutely, Mr. Speaker, and I hope that when we table our budget, the opposition will support the measures we're taking.